Hey everyone, welcome to our amazing broadcast. And let me tell you, you're not here by accident. You're not here by accident. If you're an African nurse and you want to come to the United States of America, this is your time. But more importantly, this is your information on how to get that done. So, welcome, welcome, welcome. This is my NCLEX class for nurses in Africa who will be joining me very shortly in the United States. I see nurses from Nigeria are here already, nurses from Kenya, nurses from Uganda. Much love from Uganda. I feel it. I feel it. So let me know as well where you are claiming where you're repping. We're going to talk about prioritization and beyond the NCLEX. This is actually part 2 because we do these monthly webinars every month. So we did one in June and now it's time for July. I hope now that you know about it, you will be with us each and every month. So in August and in September, you will be right here with us. I see you, Ghana. I see you, Uganda. Amazing. Amazing. So we have nurses from all over. And I am so happy that today I am joined with my partner, with my co host, and with a visionary who really has love for the journey and the idea of taking nurses to the next level. So I'll be introducing my partner, Paul Simiyu RN. He is a nurse. He is an international nurse, and he is a amazing role model. So welcome, Paul. Welcome, Paul, to the
Thank
webinar
you.
today.
Thank you so much, Prof, and receive greetings from UK. I hope you're doing well in Ohio. And this is a wonderful moment when we actually having a session for our African nurses. It doesn't matter where you are, whether you're practicing in Qatar, Saudi Arabia, Dubai, UK, where I am, Ireland, Germany, provided you have the roots in Africa. This session is exclusively for you. And the reason why we're doing this so that we can actually empower as many nurses as possible. As you've heard from Professor Regina, I'm Smith Paul Aren, the Managing Director to KenyanNurse, and also one of you, one of you, where I've trained as a nurse from Kenya, practiced as a nurse in Kenya, and I had to make a decision to relocate the way you're making this decision today, the way you made the decision last month, last week, and I came to UK. The journey itself is not as easy as people might actually view it externally. Those of us who've relocated, we understand it takes so much to actually pack your life in a small box, in a small bag, and actually start your process of having new life. And it's with that understanding that we have Kenya Nurse Consultant Limited to support you through that journey. As you make a decision, you start your first step as you proceed until when you land in the US. So if you are interested to work with us as a nurse, I wish to actually communicate to you that we are quite supporting all nurses from any part of Africa, whether they are working in other regions, provided you have African roots, we are there to support you. And we do support you with international nurse recruitment, where we signpost you to various jobs that are available. We also support you with career guidance. Maybe you're at some point stuck with your decision whether you need to relocate to US, and in US which state. We are there to guide you, and we're there also to support you when you want to do your career development. We also support you with the other requirements. For example, if you want to register in US, how do you go through the ropes so that you can have the license? We understand for you to get that license, you must sit for the NCLEX exam. But before you sit for NCLEX exam, series of documentations are required. We work with you through that process of documentation and compliance, and we are so good with it. Our compliance is actually close to 100%. When you actually are looking forward also to get maybe an admission to do your advanced nursing education, we are there to support you. And finally, we also prepare nurses and other professionals for English proficiency exam, which we start from the start point to the end. As you can see, our process is complete. When we specifically for nurses who are relocating to US. When you come to us, we give you information on how to do the process, on how to actually process. After we've given you the process, you make a decision. Once you make a decision, we bring in Professor Gina to actually prepare you for NCLEX. Once you've done that, we handle the documentation. And our documentation compliance is 100%, as I said. With all this support, you realize it's quite executive, where you get support with every part of the process and everything is aligned for you. And this alignment of all the support is to ensure that you become a USRN in 6 months. It means you get licensure to practice in the US in 6 months. And together with ReMar NCLEX, being led by Professor Regina, the number one NCLEX trainer in the whole world, we are able to make this possible because we are crushing all the challenges that nurses used to face. And all these challenges are now out of your way, and we make it possible for you to become a USRN in 6 months. It doesn't matter where you are, whether in Uganda, Nigeria, Ghana, Kenya, we actually are going to work with you step by step until you become a USRN in 6 months. And it's possible because we've done it. So many nurses have done it. The only challenge we are getting from uh, nurses is nurses are processing with several agents, which we acknowledge. But the challenge they're getting in those agencies is actually something that I also wish to highlight. When you actually process with some other agencies, you're likely going to be delayed your period, your process, in terms of some of these agencies are going to make this play up to 5 years. And that's why you'll be surprised. Myself, I came to UK the last 6 years. While I was in Kenya, there were nurses who were already processing. And as we speak, the same nurses who are processing are still in Kenya because the agency took like 5 to 6 years. While I've come to UK, I've gained every rights in the UK as a resident. I've worked for 6 years. And that person is still, who actually started ahead of me, is still in the process. And you ask yourself why? It's because some of these processes are delayed either by the agency you're working with. That's why you have to be selective, you have to be careful, or by yourself. You also have to take some responsibility because you made a decision to go with that agency. And then I'm also going to break down to you how some of these agencies and how you personally are responsible to that delay. Because the process itself is quite clear. You notice that some of these agencies will take close to 2 to 4 years of your process. It means they are delaying you 2 to 4 years. How do we get to 2 to 4 years? This is a breakdown, and I want you, if you have actually been delayed anywhere, to comment somewhere in the comment box and actually tell us how are you delayed, and you'll be actually be able to help someone outside there who is actually making a decision now whether they choose that direction or not. So most of these agencies take time to review your application. Of course, the only way you can apply to them is to write an email. And this email, some of these agents will take to 6 months for them to actually review your email. And this causes your delay. After they have reviewed your email, they might take 4 months just to review your one-to-one virtual interviews, just that they can understand your clinical background, they can understand your experience, which is a normal procedure. But the duration it takes for them to align everything causes that delay, and this delay has impact on you. And when you are coming to overseas, there is one thing you need you to understand as a nurse. I need you to understand that time is money. So anytime you waste, you're spending more on that process. And that is why our process will be faster, efficient, and cheaper because we are saving your time. It means we are saving your money. Next is these agencies, once they have reviewed and they have now noticed that you are a credible candidate, you have the experience they are looking for, they are now going to schedule you to start the process, which they require you to sign a lot of agreements, a lot of contracts, and they now start scheduling to make payment. Maybe you start your NCLEX training for them to actually pay because they outsource NCLEX training. For them to pay for NCLEX training, you have to really prove to them that you are going to stick with them. If not, they are going to delay. And I'll explain why they normally delay mostly nurses from Africa, and you're going to actually agree with me. So once they have now made a decision to sponsor for NCLEX, It takes close to 6 months before you do so. Now, as you do the NCLEX, remember the CTFNS, they're going to pay for you. If they pay for you as CTFNS, they are going to delay. How are they going to delay? Because the person who pays for you controls the process. If you pay yourself, you control your pace. But if you let someone else pay for your process, they are going to control your process. They're going to actually have a control on how faster you can process. Then you've now commenced the CHFNS. You are ready to sit for NCLEX exam. When you are ready to sit for NCLEX exam, they are going to take their own time. And those of us in the comment, you're going to share with us your experience. You are ready for the exam, but just getting that approval for the exam to be booked, it took some time. And that is what we are crying. And that is why we want to crash off. We want to remove all those controls, all those barriers, and make it your process so that you control the process. And we do that at KenyanNurse. That is one most reason why you need to work with us so that we make you a USRN within 6 months. So they are going to delay you close to 4 months. Do you understand why they delay you? This is the reason that most people will not share with you. Is these agencies are processing for nurses from across the country, across the world, Philippines, India, Caribbean, Africa, and now they had to make a decision whether they pay for someone in the Philippines or they pay for someone in Uganda. You know you have the answer. They're likely going to pay for someone ahead of the other one. You have the answer. You can yourself actually align those numbers. So, do you want to wait until they make a decision to pay for you? Or you can work hard, save a little money, and save your time. We guide you, we process you, you're going to become USRN. And these are the clear distincts when we speak about other agencies and KenyanNurse. With KenyanNurse, we start with you immediately. Immediately, you reach out to us through an email that is on the screen. That is customerservice@kenyannurse.com. You can also WhatsApp us on +254 716 192 248. Immediately you WhatsApp, we give you the breakdown in terms of payment. And once we have given you the breakdown, we commence your process immediately. And that is a distinct with other agents. Other agencies, you have to take 6 to 10 months before you commence your process. And for us, with those 6 to 10 months that you are waiting for other agents to commence your process, for us, we've already commenced. Number two, you do not sign any contract with us. It's your process. We are only holding your hand. Why should you sign a contract with you? We do not hold you at ransom. It means we support you. It's your journey, it's your process, and that is how you own the process. You access all the logins. You are able to make decisions along the way. So with other agencies, you must sign a contract, you know that, and whoever gives you the contract determines the terms and conditions, has to write those terms and conditions. Next is, for us, you don't need to have IELTS to start. You can start as you work on IELTS. However, we encourage people to consider also doing IELTS early, because when we are done with NCLEX, you need to do visa screening so fast, which requires you to have IELTS. The other agencies will have it a rule that you must have IELTS. Next is, for us, you don't need any nurse experience. We understand that NCLEX is a qualifying exam, meaning it's all for newly qualified. So you don't need to demonstrate an experience. You just need to actually come to us and we are able to guide you. However, it doesn't mean that you can process without your home country license. If you are a student doing nursing at the diploma level, my advice, which is personal advice, is this. When you are in your final year, third year, you start NCLEX training with Professor Regina. You have the start. Then you now process your license. You can now proceed with CHFNS and be scheduled for the exam, and you save on time because the same content you are using with Professor Regina, you can use for your national exam. If you are BSN or a nurse student who is pursuing a degree nursing program, every country in Africa, they have internship for BSNs. So you start NCLEX training at BSN level. So by the time you are done at internship level, by the time you're done with internship, you'll have already grasped the content, understood the content, and you now just move in to book the exam because you'll be issued with the license after your internship. So I want to rephrase there. If you are a nursing student from Africa or from an African university, you're pursuing a diploma, the best time to start your NCLEX training with Professor Regina is during your third year. If you are a BSN or a degree student, the best time to start your NCLEX training with Professor Regina is during your internship. So that the first time you get your license is the same time you are booking for the NCLEX exam. Within 2 weeks, you've sat for the exam and you are already a USRN. Imagine being a newly USRN, newly licensed in your country, and on top of that, you also are USRN. It means amongst your first interviews you're going to be doing are from US and so forth. Let's proceed. You also don't need to have a lot of in terms of bed capacity because we don't need your experience. Other agencies, you need experience, you need bed capacity, and so forth. For us, experience comes in when you are now applying for the job, not when you are starting the process, not when you're doing NCLEX. And with this, it means with KenyanNurse, you are going to be a USRN in 6 months, while with other agencies, you're going to be a USRN in 2 to 4 years. So, how is it going to bring a difference? It's going to bring a difference because there's something we call retrogression in the US. Retrogression, it means this application is made and you have to wait for your priority dates. So the time you become complete everything in terms of case completion, you are going to wait for close to 24 months. And that is applicable to across the nurses in the whole region. So if it's going to be applicable across the whole region, it means the more you delay your process, the late you go into the priority dates. The more you take 5 years, remember, priority dates are around 24. So if you're going to process to become your USRN in 5 months, you need to add on 2 years. So that gives you 7 years. But the earlier you do it, especially for student nurses, either BSN, diploma, degree, you are going to be among the first one to join what we call priority dates. Apart from the priority dates, as Kenyans, we also guide our nurses to actually go through what we call HB1 visa, which is not affected by retrogression. So all those valuable resources are accessible to you without any contract. And all these resources are also made possible by the wonderful training that is actually being offered to you exclusively from US by Professor Regina, the number one NCLEX trainer, and that is why you need to make a decision today. If I did not make my decision to relocate the last 5 years, 6 years, believe me, we could not be here. But since I made that decision, you see, a lot has changed. I've had positive impact on so many lives, on so many nurses, and we have done a lot. So that is why today is your day to make that decision because I need you to actually look back in the next 2 years, look back in the next 5 years where you'll be. You'll actually be proud of yourself because of the decision you made today and so forth. So for us, we are there to support you. Professor Lina is there to guide you through all those complex, tricky questions, make them simple, break down for you. And she's doing all this to ensure that you become this USRN in 6 months. And that is how I can summarize the process. With us, when you come to us, the first step you're going to start is we hand you over to Professor Zena straight away. You start with NCLEX training. When we continue with NCLEX training, you join now the documentation stage, which we guide you, the CTFNS documentation, where you get the SES report. After that, we take you straight away to State Board of Nursing. We help you choose a state, not based on that is the state you're going to practice. No, that state is because of the processing. It's more efficient, it's more faster, it's more cheaper. We choose a state because when you are ready now to relocate, you can transfer your license to any state that you wish. So the same state we use for processing is not the same state you're going to stay or you're going to relocate to. I need you also to be aware of that. Once you've now covered the State Board of Nursing, you're going to be authorized to sit for the exam by receiving what we call authorization to test. After that, we are now going to be ready to schedule for your exam. And for those of you who are outside Kenya, want to be patriotic enough, want to be Kenyan and invite you in Kenya, we have an exam center that is so special. 57 candidates per day. All of you are welcome. And maybe I just also want to demonstrate the timelines using another slide as I look forward to conclude is when you come to us, we are going to call it week one. Immediately, if you're coming to us today, tomorrow, Monday is your week one. And we are going to count literally the weeks. and we are going to be updating you. You are now on your week 2, you are now on your week 3, you're on your second month, and on your second month, this is what you are supposed to have. You are supposed to have done CTFNS. And we are going to work with you through that process. As you're going through the process of CTFNS, State Board of Nursing, you'll still be continuing with NCLEX training in the hands of Professor Regina for all those 6 months. We do the job, we do the documentation, and you continue in the care of Professor Regina. And we are going to ensure that you've become a USRN in 6 months because so many nurses have done so. Why not you? If I can give you the numbers, you'll be surprised. Right now, we're closing 200 nurses who have done NCLEX within 6 months. And it doesn't mean that they're only in Kenya. No. I have several nurses in Saudi Arabia. I have several nurses in Qatar. We have several nurses in Dubai, in Germany, in Ireland, in UK, who are processing with us, from Kenya, from Nigeria, and we guide you through the whole process. When it comes to school verification, we do it. When it comes to your nursing council verification, we do it. When it comes to your communication with the various bodies that are responsible in the process, we do it so that you use that time to actually focus on your NCLEX training. I hope that makes it clear. We take a lot of burden from you so that you can now use your energy and focus on passing. Because we can do school verification for you, but we cannot study for you. Professor Regina can teach you, but she cannot sit that exam for you. So that is why we need you to focus all your time, all your energy in the NCLEX preparation. So you walk out of the exam room with smiles. And for those of us who are not preparing with us, who are not training with us, I'm happy to communicate that Professor Regina has given us some slots, and she's given us a chance to train both the diploma nurses and degree nurses doing the NCLEX RN, and also those of us who are certificate holders. We call them enrolled nurses. You can also pursue what we call NCLEX for practical nurses. And this is also something that we are doing. So for August, we are having 150 slots. And for August intake, we are starting our intake as from tomorrow. As from tomorrow, we commencing the August intake. So if you are available today, reach out to us on WhatsApp number +25471619248, or email us at customerservice@kenyanurse.com so that our team will be able to reach out to you tomorrow morning and you commence your process. With that, it means you are going to be a USRN in the next 6 months. That is somewhere January, that's somewhere February, you'll be a USRN. And I can say a lot. I am so passionate about relocation. I'm so passionate about African nurses. I'm so passionate about the US process. I'm so passionate about you becoming a USRN in 6 months. But I have also to remind you, you're not going to become a USRN by documentation. You are going to become a USRN by passing that exam. And for you to pass that exam, you need to be prepared by the best. And may I have a pleasure of bringing back the best number one NCLEX trainer to give you the best tips on how you can approach all questions around prioritization. And also, she can also share nuggets with you. How is life after NCLEX? How do you secure your license? How do you become safe nurse where you're going to work? May I have a pleasure of welcoming Professor Regina back so that I can also listen to her precious nuggets when it comes to NCLEX training. Welcome, Prof. Regina.
Mike is muted. Thank you so much, Paul. Simi, you are in. We are learning about the process, and we are so excited for the nurses who you said 200. We are so excited for those nurses who have completed the important part of the education training. And so, you being there to guide them along the way, I know everyone can tell that you are experienced in this, you are knowledgeable, and you've also done the hard work of leaving your home country as well too, which we know was not easy. So I am happy to be doing this NCLEX class. And Paul, you don't know this, but I have put in a special part of the NCLEX review just for you because I wanted the nurses to know what it's like if nursing in the UK and comparing it to the United States as well. So don't go too far, Paul. I will be bringing you back on to do some language in the UK. All right.
Thank you so much. Yeah.
All right. For the rest of us, hey, check this out. We are going to absolutely get into our topic for today. We're talking about prioritization and beyond the NCLEX. If you have your quick facts for nursing school, quick facts for NCLEX, I apologize. Out, get it out because we're going to be reading this book on today as well. But let's get into it. We need to pick up where we left off in our last class. We started with this idea that NCLEX is indeed an important exam, but it is also a transition tool, meaning that when you're studying for NCLEX, you are also getting a understanding of what the culture is like in America. You are also getting an understanding of the diseases that the patients have here in America, which may be different if you are in Africa in any of the countries. So these are all training things that will help make you a better nurse. So how we are speaking in America, you get exposed to that when you take ReMar's NCLEX review. So I wanted to bring Paul back on because speaking of the language that we use, medical terminologies differ from around the world. Is that right? So I did some research on things that nurses say in the UK versus things that nurses say in America. But I'm not in the UK, so I need Paul to verify some of these things. So let's bring Paul back on. Okay, Paul, here's the first term. Do you say in the UK antenatal? Because in America, we say prenatal.
Yeah, fortunately, even in Kenya, we used to say antenatal, and in UK, we also say antenatal.
Okay. In America, we don't use that term often at all. Everything is prenatal, prenatal care, prenatal unit, prenatal diagnostics. So that is one interesting distinguishation that you need to know before you come over. Let's look at the next word. Adrenaline. Adrenaline. Is that a common medication in the UK? Because we say epinephrine.
We say adrenaline.
So that's interesting.
That's
If
correct,
it,
Prof.
yes. So I have never seen an order written for adrenaline ever. And if a doctor probably asked a nurse for epinephrine, she would need to get that right away because it is an emergency medication. So just mark these distinctions because they will make you more work ready, work ready. Okay. Adrenaline, adrenaline. Let's see this next one. Is this thing? Nil by mouth. NBM. We say NPO. What about you?
In UK, we use both nil by
Mhm.
mouth and nil by oral, and I think it's also quite applicable in Kenya. Both
Okay.
can be used.
Both can be used. Okay,
Yeah,
I understand. All
yeah,
right. So we
yeah.
we distinguishly just say NPO, nothing by mouth. So I think those are little things that Paul we need to keep doing so that nurses know the language differences and just the cultural variations in the hospital. And I think this is why it's so important to promote the NCLEX preparation because not we're not using, even though we're doing the same things, sometimes the little distinctions will help us stay more aware of what our colleagues mean. Okay. Yes, what our colleagues mean. So I think I just had the three for today. We'll do some more on the next webinar. But thank you so much, Paul, for verifying the language of the international nurse. I appreciate that so much. Thanks, Paul.
Thank you so much, and thank you for the good work. We look forward to have more.
Yes, yes. Okay, everyone. So we are getting back into it. Remember, the last class we went over prioritizations, and there were critical checkpoints like considering the patient's trajectory and the consequences of delaying our patient care. So I just want to review for those of you who missed that class because these were so important. I want to talk about number one, that patient trajectory and having in your mind, where is my patient headed if I do nothing? If I do nothing. Sometimes NCLEX will present you with patients who are not so critical, And so when those conditions are subtle but worsening, can you determine your priority? So here's a practice question coming up. Paul and I, we don't ask you to pay for this class. We never asked you for training. The only thing that we asked you to do is what? Participate. When you're here, give 120%. So I want to see comments. I want to see your answers. Here is an NCLEX practice question discussing patient trajectory. Okay. And remember, we're asking ourselves, all right, if it's an airway problem, what will happen if you don't act now? All right. What will happen if you are not, able to spot these changes? So here's the question. Make it large here. An elderly client with a urinary tract infection becomes confused and agitated. The nurse assumes it's age related and delays action. Hours later, the client is found unresponsive. What is the likely consequence of the nurse's inaction? Is it number one, the patient received too much pain medication and it went unnoted? Number two, the patient's dementia progressed due to increased dehydration. Number three, the patient needed proper orientation and fell due to agitation. Or four, the patient developed sepsis. We know the patient had a urinary tract infection. They were confused and agitated. The nurse missed this thing, assumed that it was because of age-related changes. What's the consequence? So I see some twos and I see some fours. Mostly fours. The correct answer here is it is right. If you thought, I see the answer is still coming in. That's right. Participation level is 100% today. I want a high participation level. Correct answer is number four. This patient did develop sepsis because confusion in older adults, you know this, is an indication. It could be an indication of infection, confusion, sepsis, but changes in the brain. All right, amazing. Okay, let's go to looking at that patient trajectory again, understanding that knowing your content, knowing your foundations of assessment, these help you detect signs of decline, not just urgent emergency. So it's going to prepare you for US nursing, where the job of the nurse is really to prevent the next problem. If your patient comes in with a complication, your job as the nurse is to prevent that patient from getting worse. Spot changes early. So let's do one more, okay? We had a lot of people pick the right answer, but there were a few people who didn't get it. Let me get it down to just 3 patient options here. So here's another checkpoint. Which patient is on a worsening trajectory, needing immediate intervention? Is it number one, a 70-year-old post-op with new confusion and an oxygenation saturation of 94% on room air? Is it two, 65-year-old with stage 2 sacral ulcer, foul smelling drainage, and a temperature of 99.7 degrees Fahrenheit? Or is it three, 30-year-old with a new blood pressure of 160 over 90, reporting 9 out of 10 abdominal pain and a headache awaiting PRN morphine? Okay, which of these patients needs immediate attention? Immediate attention. And I made it challenging. If it feels challenging, then you are right, because I did make this one challenging. I gave you 2 patients with new symptom presentations. New symptoms. So now what do you do? Now, what do you look at? All right. What are your assessment skills? What happens if you never come? That's what you need to think about. So the correct answer here, I see some people saying it's 1 or it's 3. I'm not sure. The correct answer is actually number 1. Number 1. Now let's look at them again, because you do have 2 patients. And the reason why I do this is because I want you to already know what it's like to be challenged before you get to NCLEX. I want you to be able to read any question NCLEX gives you and still remain focused. So you have 2 patients with new issues. One patient is how old? 70. The other one is 30. Okay. One patient, the 70-year-old, is a post-op patient. Okay. Those patients are critical and they have new confusion. Confusion affects what? The brain. Okay. What's going on with this patient? Where the 30-year-old, they do have a new blood pressure, 160/90, but they are reporting abdominal pain, 9 out of 10, and a headache, awaiting morphine. So they even have medication that they can get for the pain. However, this number 1 patient, we have no idea what's going on with this patient. We have no idea. So this is our priority patient here. Okay, and I hope you understand why. Confusion is critical, especially in the elderly after surgery. All right. And so we're going to get more into it. I actually have some more prioritization questions just like that one. You didn't do as well as I wanted you to do on that one. Let's see how you do for these ones. This is another priority question. We're going to take it back a little bit. Take it back a little bit. Let me make it big for you. Who should the nurse see first? I want everybody here. There's 219. I want 219 comments. Who should the nurse see first? Number 1, post-op patient with 100 milliliters bloody drainage in a Jackson Pratt drain. 2, post-op patient who is not voided in 6 hours. 3, patient with 101.1 fever after a knee replacement. Or 4, patient requesting pain medication before physical therapy. Who is your priority here? I got nurses representing from all over today on this lovely Sunday morning or evening, wherever you are. And this is what it's about. You do have to take NCLEX alone, but you do not have to study alone. You do not have to prepare for the journey alone. So, ReMar Review and KenyanNurse Consultants, we are here to help you. Well, looking at all of the choices, the correct answer here is definitely number 2. The post-op patient who is not voided in 6 hours. Patient has had surgery, and if there is no urine output in 6 hours, when we know that you're supposed to have at least 30 milliliters every hour, our patient may have some nerve damage or some other kind of obstruction. All right, let's do the next question here. Question number 2. I'm also asking you, which client should the nurse see first? Is it number 1, a diabetic client with a blood sugar of 58? Number 2, a client who wants to speak to the nurse about poor sleep. 3, a client reporting mild nausea after chemotherapy. Or 4, a client coughing, awaiting TB results. Well, this is interesting. We do have some priority patients here. And remember, with NCLEX, all of the patients need something. But who needs something first? So if we get it down to 2 or 3, is it 1? Is it 3? Is it 4? 4 is coughing. They are possibly TB infected, or 1, they have a low blood sugar. Who's the priority? I'm so happy from what I'm seeing today. All right, this question is showing me that you're safe nurses. Correct answer number 1 absolutely is number 1. Hypoglycemia It's an emergency because glucose is the brain's only source of energy. Only source of energy. Our brain needs it. So when the blood sugar is low, the patient can quickly, rapidly slip into confusion, seizure, and coma. Well done. Well done on this one. Next, I am moving on to question number 3. You did good on that one. How about this one? It's a little bit more challenging. Which client requires immediate attention? Is it number 1, a central line client with new onset of fever and chills? 2, an ambulated client, new onset of feeling dizzy and faint? 3, a client with 3 plus pitting edema and a new report of leg pain? Or 4, a client requesting a chaplain? You got 4 new issues here waiting for you to prioritize who is the most urgent, who's the most immediate. You all are doing very well today. The most difficult part is just showing up. The most difficult part is just showing up. And as we're going through this, I want you to evaluate whether this is helpful to you. Are you learning? Are you excited about studying? Are you ready? Because that is what makes the process so much easier when you're actually excited about it. We're going to get into quick facts for NCLEX here in just a few moments. So go ahead and get that book ready. The correct answer is absolutely number 1, a central line client with new onset of fever and chills. I couldn't fool some of you. You had it. You had it. All right. And I think I got one more bonus question for you. You have an ER situation. You're working in an American emergency room and 2 patients come in. Who do you see first? They both have respiratory problems. Is it number 1, a client with acute asthma who is using accessory muscles to breathe and has wheezing? Or a client with a suspected pulmonary embolism who reports sudden chest pain? Who's your priority here? And this is why you show up to your ReMar study sessions so that you can experience high level thinking, critical thinking. That's what we're doing right now. I'm forcing you to critically think who you're going to go, see first. One or two. Oh, I think I have the safest of all nurses today. The correct answer here is number 2. Number 2, the client with a suspected pulmonary embolism who reports sudden chest pain. This is our priority, as a pulmonary embolism will get lodged into your arterial circulation, and then the patient is not able to survive. This pulmonary embolism can cause immediate death, right? And so this is your priority when it is against most other respiratory conditions. All right. Pulmonary embolism is going to supersede asthma, shortness of breath, right? Most of those things, because it is just an emergent condition. And the treatment for it is surgical intervention. So you need to be able to get that patient quickly to what can save their life. All right. And this is what it's about for training for NCLEX. Some of these things we don't know unless someone teaches us. And so when you come to these classes, and what I love about working with you all is that you are ready to be students. Even when I am working with the educators and the deans of the nursing school in Kenya or Uganda, the schools that I'm working with, when they're there to learn about NCLEX, they have the mentality that I want to grow in this area. I don't know everything. There are some things that I need to know in order to be successful. So when we're talking about NCLEX, there are some things that you need to know in order to be successful. So now let's go inside of Quick Facts for NCLEX and turn with me to page number 8. I wanted to discuss this very common disease process, right? In the United States, it is one of the most common reasons that a patient has to have abdominal surgery. Abdominal surgery. So, appendicitis, I'm expecting it to be on your NCLEX. Now, in your country, I don't know if appendicitis is as common as it is in the United States, but it is very common in the United States. So, I wanted to read the points that I have here in Quick Facts, and I wanted to focus in on some things so that you don't miss it. Because when you look at, and you guys know Quick Facts is a question and answer book, right? So let me go to appendicitis. So it's all question and answer. Question and answer. Question on this side, answer on this side. This is the beauty of studying with Quick Facts. And if you need Quick Facts and you don't have it, this book is in Africa already. The multiple offices throughout Kenya and Uganda have them. So if you are near in the continent, anywhere in the continent, you can get this book, and you need to have it if you're studying for NCLEX. So appendicitis is down here, and it's not a, oh, thank you. So it's common in Kenya. Awesome. Okay. So appendicitis is just this small section here and then this section up here. It's not a big section at all, but there is so much information that I don't want you to miss it. So we're going to read it together. Okay. All right. All right. So appendicitis. When we talk about the appendix, and we look at just the term appendicitis, we know that this is an inflammation of the appendix, right? But I want to ask you, do you know what type of organ the appendix is? Because if you understand what the appendix does, then you can anticipate the complications of this particular organ getting inflamed, right? So, what kind of organ is the appendix? And this is how you should be reading Quick Facts. Don't take anything for granted, right? So, we think about the appendix. I don't see it in the comments yet. What type of organ is it? Not where is it? I know you know where it is. There's some things that we do know, right? So I want to try to push you a little bit further. And we won't be in this long. We're actually going to close the class here. So the appendix is a digestive organ, and it is also an immune organ. It's a digestive organ because it is attached to your colon, right? And it is storing bacteria for digestion in the appendix, right? It's an accessory organ too, right? And so it's a digestive organ, and it's also an immune organ because it has lymph fluid in there as well, right? So when you think about this organ becoming inflamed and possibly rupturing, what's going to be the result of that? So think about the appendicitis. What is actually inflamed? All right. And then I have here, which age range is most affected with this condition? And if you can see the age range here, 10 to 30. So what does that mean? That means children. That means teenagers. That means young adults. These are the ones that are most likely getting appendicitis. Why is that? Typically, when we're talking about disease processes, congestive heart failure, COPD, we're talking about older adults to elderly. But here with appendicitis, this is a young person's disease. Why? What makes it a young person's disease? Well, it's simply the fact that a smaller appendix is easier to get blocked. The appendix is it is most active in young people. So that means it's more of a chance to get inflamed. And the appendix of a 15-year-old, a 16-year-old, a 17-year-old is working much harder than the appendix of a 60-year-old. Okay. So it's a more chance for it to get inflamed. But a lot of people don't know that, right? So when we talk about appendicitis, we are ready to say where it is. Everybody knows that appendicitis, we're talking about the right lower quadrant. But actually, the first place that people will feel An inflamed appendix is where? It's actually the belly button. It's around your umbilicus, and then it moves to that right lower quadrant. So anytime somebody is saying they have right lower quadrant pain, and we know it's appendicitis, we know that this problem is far, far progressing. Okay. The right lower quadrant pain means that the appendicitis is severe. So that's why it's one of the markers. Now, the reason why it starts in the umbilical cord is because the appendix and the structure of your umbilical cord shares the same nerves. So when you get your umbilical cord cut as a baby, those nerves go away for the umbilical cord, but the appendix still needs those nerves. So when people have pain in their appendix, they feel it first in their belly button region. All right. So now let's talk about the other signs and symptoms, because right lower quadrant pain is important, but also here I have the patient will have a loss of appetite, nausea and vomiting. Why is that so important for a patient to have with appendicitis? The nausea and vomiting, yeah. So it's pain that shifts to the right, the left, the lower right quadrant. Yes. Nausea and vomiting is so important with appendicitis. And it's almost something that you don't need to take away from a patient. It's good for a patient with appendicitis to have nausea and vomiting. Why? Why do we want our patients to have that nausea response, that vomiting response? How is that helping the patient? Did you ever think about that? Yeah, so when you have that GI response where you are nauseated and you're vomiting, you don't want to do what? What does that deter you from wanting to do? That deters you from wanting to eat, okay? And if you're not eating, then your stomach can shut down. Your stomach can be turned off, right? Per se. And so that's going to help your appendix. That is going to help your appendix. So nausea and vomiting is really God's way of protecting the patient. All right. To reduce that abdominal pressure, yes, to make sure that the patient is not producing more gastric acid, to make sure that the patient doesn't need more digestive enzymes, and then the appendix has to work. Okay. Good job. Now, let me ask you this. I have here, so now you understand the loss of appetite, nausea and vomiting, low grade fever. What is that about? This is an inflammation. Why is it a low grade fever and not a high grade fever? Because if you think about it, appendicitis is very, very serious. Why is the fever only a low grade fever? What does that say about the condition? Whenever we have a low grade fever, especially with appendicitis, then we know that the body has contained that inflammation, contained that infection. And so, where is all the infection contained right now? If it's a low grade fever, it's all in the appendix, right? We know if it's a low grade fever, the appendix has not what? It has not ruptured. Okay. So the body is working locally at the site of the appendix with that inflammation. So we know that's why it's a low grade fever right now. All right. So we're going through the signs and symptoms. The next question here says the localized tenderness. Where is it found? It's going to be found at McBurney's point. If I asked you where McBurney's point is, I would expect you to say the right lower quadrant. All right. That's one of the things you got to get. So the rest of the information here you can read on page 9. I do want to look at the what is the treatment for appendicitis, because there's an important point here. The treatment here options that I give you: immediate surgery to remove the appendix. Okay. Immediate surgery to remove the appendix. What type of treatment is this? Is this pre-rupture or post-rupture treatment? Immediate surgery to remove the appendix would be considered what? Is that pre-rupture or is that post-rupture? Somebody put it on there. This is the these are the details. These are the details that you miss if you're studying too fast or if you don't study at all. If you don't study at all, right? And this is how really great nurses can fail the NCLEX. This information here, this treatment is pre-rupture. Absolutely. Okay? You can remove the appendix before it ruptures. Now, after the appendix ruptures, because remember, when a patient says, "Oh, I feel so much better," for appendicitis, that's not a good thing. That's a bad thing. So we can take out the appendix before it ruptures. If it ruptures post rupture and surgery is needed, what is that surgery trying to do? What's the point of giving a patient surgery after the appendix ruptures? Because you're not going to be able to find it in the same way. So when the surgeon opens up the patient post rupture, what are they doing? Think about what we said the function of the appendix is. So if it ruptures, what are we doing? And listen, if you don't have this book, the next time I do this class, you need to have contacted KenyanNurse consultants, because it's not enough for you to just come and watch YouTube. These YouTube videos are to help support you, but you still have to be doing the work. And you will know, you actually are able to tell where you are if you need more help just by the way we're answering these questions. So very good to prevent sepsis, to prevent peritonitis, because when the appendix ruptures, everything that appendix was holding is now released into the peritoneum. Exactly. So the surgeon is going in there to suction and clean up all of that, all of those particles that will cause infection. That's what the post-rupture surgery would do. That's what the post-rupture surgery would do. All right. So the other things that are there, we don't want the patient to be eating. We want to rest them. The purpose of Fowler's position is so important here. And you want to know the difference between pre-rupture and post-rupture. So pre-rupture, we're putting the patient in Fowler's position to reduce the pain. Yeah, to reduce the pain. Post-rupture, we're going to use that same Fowler's position. But post-rupture, it is to trap the infection. Okay? That means we're going to keep the infection where it is supposed to be, which is right in the abdomen. We don't want it to spread to the lungs or the brain. Very important, very important. And then the last thing that I want to say is that when you are studying for NCLEX, sometimes heat, the process of applying heat, will be stressed, right? For patients with appendicitis, is heat good or bad? Are we putting heat to our patient? Is that good or bad? Now, some of you will know. I'm looking for the answers. Is heat good or a bad thing? Heat is bad. It's bad. We don't want to apply heat to the abdomen. This is very important. Now, I know you know that it's bad, but why is it bad? And I see Kate put it on there. Heat actually draws blood to an area. So yes, it can increase inflammation, right? Because when blood comes to an area, circulation comes to an area, it speeds up the inflammatory process, which we know our patient doesn't need. They don't need more inflammation. They already got it. So it will actually speed up the rupture of the appendix if a nurse who is untrained, who is unsafe, gives heat to that area. Very, very important for us to know as well. So again, quick facts is used to evaluate yourself, but also speed up your comprehension so that you are ready to test. Most people can read this book, go through it about 3 times, and they should have everything memorized. However, you need to be coming to our study sessions. We have them Mondays and Wednesdays. We also do them monthly just for you right here, because this will also help you to draw out the most important points that I intended for you to know when I wrote this book. So, quick facts for NCLEX, extremely important in the process. Remember, as we close this class, I'm going to invite Paul to come back in. I see you all have questions. But great work today. Remember, for NCLEX, NCLEX doesn't just want you to know nursing. It wants to know if you can lead nursing. And that is a very distinct responsibility of the nurses here in my country. We are responsible for the patient's health and well being. We are the last safety point. Before that patient gets a medication or a treatment, it's always the nurse that has to prepare or send or administer. And so, nurses in the US, we don't wait for orders to think. We have to make the first move. We have to know how to prevent harm. And that's my expectation for you. And I know that you can get there with the proper training. And that's what we are preparing you for today. Your test will be sooner than you think. And so today is the day where you should have the acceptable mentality to say, I'm going to take this serious. I'm going to commit to this process. So I'm going to bring Paul back on so that he can tell you. People were asking where to get the book. How can I get the book? These are all great questions. So Paul, RN, people are excited. They want to study. They're ready to go.
Yeah, I'm also excited, and you've raised an important item that if you have a chance to save life, if you have a chance to take an action as you're looking forward, as you're looking after a patient, and you fail to do so, there is a clear direction of the uh, co- clinical condition. So the same applies to your personal life, your personal journey. If you don't make a decision at the right time, there is a consequence. And most of the time in life, we don't regret the things that we did wrong. We regret those things that we had a chance to do, but we did not do. So as a nurse from Africa, this time you have this great chance to be prepared by Professor Regina, to be supported by KenyanNurse Consultant Limited at your comfort. This is a chance you have. Don't wait until you regret. Make a decision today, take action today, and actually save yourself. By saving yourself, it means you give yourself the best life. So if you are out there, we have been supported by Professor Regina, and we now have actually 150 slots as from today. She's already released them to our end, and these slots are for you to make use of them. Make a decision today and join us and be among the 150 nurses that we are going to support. If you are a diploma holder, you're going to do the NCLEX RN. If you're a degree holder, you're going to do NCLEX RN. If you are an enrolled nurse, you're going to do NCLEX PN, and all these options are available with us. The training is a 6 months training, which comes with the two books as a gift to you. The two books are the Virtual Trainer, NCLEX Trainer, that is V2, commonly known as V2. Then we have the Quick Facts. Those are the nuggets that are summarized from all the massive books into one small book that you can always carry around with you. So if you're looking forward to access these books, if you're looking forward to join the wonderful 6 months NCLEX training, by Professor Regina straight away from US, you can be able to get that from the comfort of your home, from the comfort of where you're working from. So if you are from Kenya, you need to reach out to us and you can pay. The training is 25,000, which is actually a discount because the uh, training was supposed to be 45,000. However, because we really want to support many African nurses, we had to request Professor Zina to give a discount to 25,000. So if you're from Kenya, you can pay 25,000 to our pay bill number, and we only have one pay bill process or one payment process. Don't be con men are outside there trying to tell you, you know, you are in the training today with Professor Regina. I need you to pay on this number. Don't pay to any mobile number. please. We only receive our payment through one official payment method that is recognized by the Central Bank of Kenya. That is, our pay bill is 4084929. And under the account name, you're going to enter your official name. Then the name that is going to come as the recipient is going to be Beginners Consultant Limited. Please, if you can take a screenshot of that, it can help access this information, refer back to it, share with your friends that screenshot so that they are able to join and work with you. Because if we work this process as a team, as soldiers, we are going to actually excel and we're going to win this battle. That is the NCLEX battle. And together with our leader, our commander, Professor Regina, we are going to win this war. We are going to be USRN, and it's going to happen in 6 months. If you're from Uganda, we have an office in Uganda in Kampala around Kiwantule Road, but you can also make payment to us through the MTN. And with the MTN, you just go to star 165 and then you press OK. After that, you get several options, but you choose the sixth option, which gives you financial services. After that, you choose one to give you the bank deposit. Then you choose one again to give you the central bank, and you enter our account number as 31001017 and 21. Then you enter your various credentials, then you make the payment. Then, if you're not from Kenya, you're not from Uganda, and you're from another country that is part of the community we are actually supporting, that is any African nurse, whether you are in Saudi Arabia, Qatar, UAE, UK, and any other country, whether Ireland, Germany, and your destiny is to go to US. We are there to support you to make that dream come true and to ensure that you are a USRN with 6 months. Reach out to us through the email customer service at KenyanNurse.com, or you can simply WhatsApp us on +2547 2248. If possible, you can share your names, and those names should be two, and your email will be able to process your process as quick as possible so that as we start Monday, we are able to start with you and make you to start your journey towards your destiny. So don't wait until you come to regret why you did not start. And with our partnership, we are going to make you a USRN within 6 months. It means you're going to be a licensed, registered nurse in the US. And this gives you a lot of power. So don't wait until your life actually takes a lot of period before you decide. This is the time to do so, and you are going to be proud of the decision you are making today. In the chat box, I'm going to share the contact. You can copy, you can take a screenshot so that you are able to reach out to me, to the team, and they'll be able to support you as quick as possible. And for Professor Regina, I'm so proud of the initiative you are doing. I do understand now you are reaching out to so many nursing schools because your initiative is not all about one-off presence. It's actually continuous process where you want now the safety to be integrated in the African healthcare system, and now you are working with nursing schools. In Kenya, I'm happy to communicate that we have 13 nursing schools that are now working with Professor Regina, aligning their curriculum, their system, their trainers to actually become NCLEX proficiency. I also acknowledge that you are preparing the tutors from those specific respective schools to become NCLEX proficiency. It's something I'm proud and I'm happy. I know outside there we have several nurses who are educators, who are tutors, lecturers, and they also want to become NCLEX proficient so that they are able to instruct students in the NCLEX way. They are willing to join us and they are actually looking for us. You can also reach out to us through the same details, and Professor Regina will be able to actually access you, and you'll be able to be supported to become NCLEX proficient as a trainer, as a educator, as a facilitator. And these schools are also lucky that they are also going to be able to utilize ReMar NCLEX system to examine their students, nurses from year one until they graduate, NCLEX format kind of testing. And this is quite wonderful. So, Prof, for that, I wish to appreciate. And I know if you have heard clearly, you can also clap for Prof in the comments so that she can understand that whatever she's doing is actually phenomenal, is something exciting, is something futuristic, is something that is inspiring. So it means you're not just looking at those who are already qualified, you're also going back to the young ones who are now joining the nursing school, who are training the nursing school. How can we support them to become NCLEX proficient from the word go? And it's an initiative I'm so proud. I know you have those schools that you're working with. If you can also take a shout out to them, we are proud to be associated with you. Thank you so much.
Thank you so much, Paul. The what you're saying is just when you hear it, you realize how impactful it is. What we are trying to do is make NCLEX a bridge that everybody easily understands, and it's not just knowledge for just a certain group or a certain country to have and own, but the information is shared freely because that will improve not only the healthcare in the country but globally. And so, yes, for those of you who are watching, and maybe you want your university or your nursing school to take part in this initiative that we're doing. We're really trying to transform the education in terms of access to technology to the nursing students from very early on, and also the local nurses. So if you are in if you're in other countries that maybe we haven't mentioned, especially if you're in Nigeria, right? If you're in Ghana, we are working with schools in Kenya. We're working with schools in Uganda, right? Clark International, Nairobi West Hospital. Who else do we have? Just so many, Lake Lorenzo, Legacy College. I mean, they show up, and I'm not just talking about one nurse. I'm talking about the deans. I'm talking about the librarians. I'm talking about the nursing faculty. So many people are invested, and it's very unique from the United States, where in the universities in the US, NCLEX is a responsibility that maybe one person takes ownership for, and people are too busy to really sit in and focus in. But here in Africa, I see that even those who have so much on their plate, they are excited to come to the sessions, and they're excited to, be a part of this transformation. And so, we have new schools that I'll be working with. I'm really excited about. We have Maseno School of Nursing. We have Uzima. They show up. Now I know I'm gonna say this, Nwancha. Is that right, Paul?
Nyanjo,
Nanja.
Nyanjo
Yes,
Adventist School of Nursing.
Adventist. They're coming on. And then we have even some more schools. I think Fafa Medical, we should be onboarding them. But we're just really trying to make the connection and empower the schools. And so in the classes, the educators are like, yes, we have to, write these types of questions, and our students need the technology. So if you want your nursing school to also experience this type of education, or you yourself learn more about NCLEX to support the local nurses, please reach out to us. Please reach out to us. But the goal is USRN in 6 months. And that is our challenge for you on today. So we hope you've enjoyed our monthly webinar, and we look forward to seeing you again on next month. Even in August, we will be coming back again. So by God's grace, most of you will have your books. I see a lot of people saying, how can we get it? How can we get it? Right there. Phone number, WhatsApp number, and email. Make that your task for this week. By our next webinar, you have the products, you have the books, and you're ready for class 100%. 100%. Great job today, everyone. We will say goodbye to you until we meet again. We're so proud of the work that you will do, and we're looking forward to seeing you. I'm looking forward to welcoming you in the United States of America. So I'll see you then. Bye-bye, everyone.